Good afternoon, all.
Good afternoon, ma'am.
Good afternoon, ma'am.
Okay, so now I'm going to share my screen. Um, Can you all able to see my presentation?
Yes, ma'am. We can see your presentation.
Okay, thank you. These are the learning objectives of today's lecture. So in today's lecture, we are going to see first, what is this informed choices? We already know informed consent, and the informed consent and informed choices are more or less similar. So we will see what is this informed choices or consent means, and to know what is this capacity and the competent, and brief out the capacity assessment criteria and the principles which are governing the informed choices, and brief out the duty of care and professional code of conduct and the professional code of ethics. And here we already studied regarding the capacity and the capacity assessment criteria under the Mental Capacity Act 2005. So here I'm going to just brief out, or I'm going to recall what we have studied in those slides. Okay. So first we'll move on to the informed choices. So what is this informed choice or the informed consent means? It is an ongoing process where the individual and the professional works together to gather and evaluate the information that will be utilized by the individual to make informed choices about the goals and services that will lead to an employment outcome. So normally when we talk about the healthcare sector, we are telling as an informed consent or the informed choices when we are treating the patients. So I already told you the treatment options that we are selecting for each and every person is not selected by the doctor or the other healthcare professionals. So before we selecting a particular treatment for an individual or a patient, we should explain all the available options and regarding the patient condition to the patient, and if the patient permitted their family members or any other close relatives or friends in the discussion of their care profession, then we can include them also. So with the collaboration of patient, all the healthcare professional and the family members, we are going to explain the patient condition, why the patient got this disease, what are the outcomes of this disease, and what are the treatment options are available, how each and every treatment options are good, and both the good and bads we need to inform to the patient as well as the family members. Then we are allowing the patient and the family members to make a discussion, and then they will propose the treatment options what they want to go through, or what they want to have. Then if the patient's choice, or if the patient decision is okay, then we can accept that one. Or if the patient decision is not good for the patient condition, then we need to explain we need to convince the patient through a proper accurate explanation, and in that manner we can alternate the patient choice. So this informed consent or the informed choice not only confined to the health and social care sector, but if we take any working environment, we need to have some informed choices. So why we need to have these informed choices? Then only the people who are involving. So when we talk about the other workplaces, so the employer and the employee, so both they should work in a collaborative manner, that then only the outcome or the goal of the services will lead to an employment outcome. So this is regarding the informed choice or the informed consent. Then we'll see what is this capacity and the competence means. So capacity means it is a clinical term which we are used to refer an individual's ability to make an informed decisions about a specific treatment. Yes, so in our previous lectures, we studied regarding the Mental Capacity Act 2005. So under the Mental Capacity Act, we studied what is this mental capacity and who are the people that can govern or we can protect by using this Mental Capacity Act. So normally here the capacity refers to the mental capacity. Mental capacity means any individual who have the ability to take own decisions on decisions for the sake of themselves. So without any third person intrusion, they are going to take the decisions for their own benefit. So that is we are calling it as a mental capacity. So here also, so here you can see an individual's ability to make an informed decisions about a specific treatment. So when we talk about or when we take the patient, so each and every patient we are, wait a minute. About a specific treatment. So it must be a specific question that is being addressed. So capacity means yes. So this is we are going to see what is capacity means. But competence is little bit different from the capacity. It is a legal term determined only by the court. Yes. So normally capacity we can identify it or we by asking some questions or with the activities and attitudes of an individual we can identify whether the person is mentally capable or not. But to know whether the person is competent or not, it is only determined by the court, the laws defined as the ability to understand and rationally apply knowledge to a decision making process. Everyone is assumed competent until proven otherwise. Yes, sometimes in some movies you have observed that they have in a court they have asked the person to go through the psychiatric referral. So why we are asking the person to go through a psychiatric referral, then through those laws we can identify that whether the person is actually competent or not. Competent means whether they have the ability to make any decisions or they have the ability to do any actions with their own knowledge and with their own ability without having any third person compulsion. So here, so but we can assume that all the people are competent. That means when I am seeing an individual, I can say that a person is a competent person. But if it is proven, but until proven otherwise. So we can assume, but we can't surely tell that the person is a competent person or not. For even for an example, so in for a job, they are hiring or they are offering a vacancy. So they are shortlisting the persons for the interview by seeing their CV, curriculum vitae. So in the curriculum vitae, they have mentioned all the experiences, the qualifications, the abilities that they can do in a particular work. But so with that CV, we can assume, okay, this person is competent enough for this job. But we can confirm whether the person can do all the things that they have mentioned in the CV. Why? without providing any work, or without providing any without allocating any task to that person, we can't confirm that person is very competent. Why? Sometimes the written parts in the CV could be they can elaborate it, or they can exaggerate their abilities sometimes. So because we don't know how they prepared, and we don't know that particular person from the starting point. So in that manner, sometimes some mistakes also could be happen, because some employers, they go through the CV only without, and with the CV they have confirmed that okay, this person is a well competent person. But after they allocated a task for that person, then they will realize the things that the mentioned in the CV is not compatible with the actual person work, because in real he may be not a very competent person. So when we talk about the healthcare sector, yes, so for the healthcare sectors, to confirm whether the patient is competent enough to take the own decision, or whether the patient is competent enough to make any actions, we are going through as a legal document. So we are proposing a complaint to the court, and then the court, the judiciary, they will have the judicial medical officers. So they will put, or they will make an order to have the particular individual under a psychiatric observation, or through the court they are going to have some process to confirm the patient's competence. So this is the difference between capacity versus the competence. So here, this also we have already studied under the mental capacity act. So how you can assess the capacity. So this person's mental capacity is okay, or that individual has a lack of capacity. So how, with what criteria that we can use to assess each and every individual's capacity. So first one is communication is a choice. Patient should be able to indicate a preference. Patient's choice should be remain consistent and free from compulsion. Yes. So communication. When we talk about the communication, it is a very, very important part, or the element when we take in any kind of sector. Not only in the healthcare sector, even in our routine work, the communication is the best part, because we are exchanging our ideas, thoughts, and our suggestions in a way of, it is a kind of way that it will be helpful for us to exchange these all the element. So communication is the first one that we can identify how the person having the capacity, mental capacity. Why? Because when we are going to talk with the patient, the way that he is answering our questions, or the way the person asking the questions, and also if we are going to tell any the treatment options, whether the patient has the competent or the ability to make their own decisions. So with that we can identify. So sometimes they can. So if the person is a mentally capable person, they don't no need any other person to take a decision, but they can use any other persons to discuss. But the decision making should be by their own self. They can ask an idea from all the people, and they won't rely on the decisions of the another person. So they can get the idea, and they can analyze all the ideas that are proposed by each and every person, and they will come to one conclusion. So that conclusion is the decision made by a particular individual, if he or she is mentally capable. And also, the decision that is made by a particular individual should be consistent. It should be firm. He or she won't change for that decisions when other person or the third person tells something else. So this is, we are telling the person is mentally capable. So as a healthcare professionals, when we are talking with the patient, we can identify what are the patient's ideas, what are the patient's desires, and when they are taking a decisions, how they are taking a decisions. Is there any third person intuition is there or not? Or how they are going to have their decisions, whether it is a consistent or they are changing according to the person and the situation. So all these things, with a good communication, we can assess the patient's mental capacity. Understand the relevant information. Yes. So it is better normally once we instructed or once we provide all the informations to the patient, at the end, again we are asking the patient to summarize it. So normally we are asking that, but you have understand so far. So you can tell it in your own words. So we are asking. So why we are asking this in this format, then only we can identify how the person's understanding capacity is. Whether the person, normally whenever a person is telling more information, as a normal healthy mentally person, we will recruit the most important matter which are important for ourselves. So as a patient, so where just as an example, when I'm going as a patient, then the physicians or other healthcare professionals, they will tell lot of things to me, but in the information, I will mainly focus on what are the important informations that will be helpful for myself. I want in asked or I want here other information. So when they are again asking to summarize those information, then it will be helpful for me to propose the important part. So then we can identify, okay, whether the patient is mentally capable or not. If he is capable, yes, he can't elaborate, but he can summarize the important points or the information that we told to them regarding his treatment option or the procedure that we are going to do in a simple manner. And patient should grasp the meaning of info provided. Yes, if he is good well enough, then he can know the meaning. So why we are going to do and each and everything he can identify, or the patient can I get the meaning of the informations they will provided. So this is another criteria that we can identify whether the patient is capable or not. Then appreciate the situation and its consequences. So we should acknowledge. So we should know how, or we should identify how the patient condition, his or her condition is now. And we should tell, or we should inform to the patient the reason, the causes for the particular treatment, and we should able to describe what are the possible outcomes. So it is also a kind of mentally we can assess the patient's mental capacity. Why? So if we are going to tell that or describe the possible outcomes and the reasons for the treatment, then the patient also starts to question us. So why we are having these reasons for the particular treatment, why this particular treatment going to provide these outcomes, so why it is better than that. So the person starts to question us. So then with that we can assess that, okay, this person is mentally capable. Otherwise, if the person think about a lack of capacity, mentally lack person, they won't ask these questions. They won't identify the importance and they won't ask those questions. They just follow what are the things that we are telling. So appreciate the situation and its consequences is also another criteria that we can use for the capacity assessment. And reason about the treatment option. So we should engage in rational conversation. Rational conversation means, so the in the conversations, whenever you are telling anything, you need to rationalize it. You need to justify it. So why you are using these words? So why did you say these? So what is the reason for saying these things? So that is we are calling it as a rationalizing. We are reasoning or we are justifying our words. So the patient should engage in that kind of conversation. That means whenever the healthcare professional telling anything, he should provide the rationale or the reason for his or her own works as well as the activities. And the patient should be able to share reason behind the choice as well. So although the healthcare provider is going to give all the reasons, so the patient also needs to provide the reason or the rationalize why he choose this particular treatment among the available treatment option. What is the reason? So why he is liking to have this kind of treatment option? Then only we can go through. So why the patient liking this, and if the treatment option is not good, then also we can, because if the patient likes one treatment option and if the patient body condition is not allowed for that particular treatment option selected by the patient, then we need to provide a good rationalize. So we need to provide a good reason for altering the patient selected treatment option. Otherwise, patient will starts to refuse the treatment. So reason about the treatment options provided by both the healthcare professional and the patient is important one. So that is, we are telling that the patient should be included in the rationalized or the rational conversation. So these four are the important criteria that we can use to assess whether a person is mentally capable. That means whether the person can have the ability to make their own decisions. So this is regarding the capacity assessment. So are you all clear up to now? Or do you have any doubts so far?
Yeah, ma'am.
Okay. Now we'll move to the principles of informed choices. What are the principle or the guidelines that governing these informed choices? So normally there are major three principles: autonomy, responsibility, and accountability. So whenever we are going to follow the informed choices, we need to focus on these three major principles. Why? Because these are the three going to rule out these informed choices. We'll see one by one. First, we'll see autonomy. So autonomy simply means self-determination. So self-determination means how you are going to determine yourself. So without any third person's opinions, how you are going to perceive or how you are going to determine yourself. That is, we are calling it as an autonomy, self-determination. A person's capacity to adequately self-govern their beliefs and action. Yes. So the ability of each and every individual to rule out their beliefs and actions when they are doing anything. So if I am going to do anything that how much I can self-govern me, or how much I can determine myself, or that means I am thinking that am I eligible to do this activity? So can I do this activity without any error? So likewise, I am determining myself in without any third person's opinion. So that is, we are calling it as autonomy. In any individual case, autonomy may be influenced by the cultural and beliefs of the individual. Yes, so normally the influencing factor for the autonomy is a cultural and beliefs. So because we are telling that autonomy, our self-determination, how we are going to control our beliefs and actions. So as it is having our own thoughts and beliefs, definitely our cultural and the our values, beliefs will start to influence our self-determination, because each and every individual having different perceptions in their culture and beliefs. So when I'm going to determine myself, automatically the first thing came into my mind is my cultural aspect, my religious aspect. So my societal aspect will comes. So the principles of autonomy requires that the right of each person to individual beliefs, desires, values, and goals be respected and safeguarded. So the major principle of autonomy, that means, so it is a kind of right that we are going to give to an individual belief. Yes, so when I am self-determining myself, I will think about my values, desires, and beliefs. So it could be so when a third person seeing my self-determination, that means my autonomical activities, it could be sometimes it's a weird for the third person. But once he once he starts to see according to my cultural and the valuable things, then only they can understand why I do these kind of actions. Okay, so when we are talking about this autonomy, so the third person or any other individual, we need to respect and we need to safeguard the each and every individual's beliefs and desires and the goals. Okay, so this is we are calling it as autonomy. So simply autonomy means it is a self-determination. So the major key points for the autonomy are respect for autonomy. So when we are giving respect for the autonomy, it involves the effective communication. Yes, again, the major one. It should be an effective communication and providing an adequate informations, a kind comprehension, competence, absence of coercion. Coercion means compulsion. We are forcing. So absence of coercion means there is no any forcing actions or there are no any constraints or the compulsion for an individual. And advocacy, the right to refuse proposed assistant equipment or the treatment procedures available. Now we'll see one by one. Yes, communication. So the communication, it should be an effective communication, which is vital for enhancing the autonomy. So communication is necessary before doing any. So here I am talking about the health and social care. So before doing or before starting any procedure, we should have an effective communication with the patient. So we need to inform to the patient why we are going to do this procedure or why I'm going to do the examination, what are the components included in the examination, and or any other researchers. So if I'm going to do any research, then I need to inform to the target population what is the title of the research or what is the purpose of the research, what are the future outcomes of the research, why I included a particular those population into my study. So all those things we need to inform to the patient. So those information should be given through an effective verbal, or it could be a verbal communication or it could be a written communication. Written communication means it's a kind of legal document. Normally for the researchers, we are giving a written document which included all that informations. That information should be written in a language. So when we talk about the Sri Lanka, if we are going to do research in a Sri Lankan community, then the information sheet should contain all the three languages: English, Sinhala, and Tamil, because we can't confirmly tell that all the people can read English and all the people can read Sinhala or Tamil. So it is better and it is important, not better, it is important through effective communication. We need to give all the three languages. So the care provider should provide the best communication, support and informations need to facilitate communication and enables the care receiver to make informed choices and decision. Yes. So if the communication best only, then the choices or the decisions made by the care receiver. So here the care receivers are the patients and the care providers are the any healthcare professional. It can be a consultant, physician, doctor, occupational therapist, speech therapist, whoever. So they are the care providers. So if they use an best communication method only, the care receiver or the patients can decide a well informed treatment options or informed choices. So here the how they can make a good communication. They can, the verbal communication is the best one, because normally in the healthcare setup, rather than giving a written document prior to, normally we are giving a written document as well, but prior to providing the written document, we are explaining all the informations to the patient verbally. So once we finish the verbal explanation, and if we provide the written documents, then it could be helpful for the patient to gain more and more idea regarding their condition. So when explaining or when providing any informations to the patient verbally, the healthcare provider must be very, very aware about the words, the phrases that they are using. And instead of the words and phrases, the tone of their voice and the punctuations, not only in the written documents, even when we are communicating verbally, we need to have or we need to maintain some punctuation. Punctuation means, so in which part we need to stop, or in which part we need to hold. So which part we need to impose. That means we need to tell those words very deeply. We need to impose those words. So those things we need to be very, as a healthcare providers, they should follow. Then only it should be an effective communication. In certain instances, care receiver unable to communicate, and there could be no one to make decisions on behalf of the client. If the status of the client is also urgent, primary need to treat the client where the ability to make consent is absent or impaired. Okay, but there are, so we are telling that before giving or before starting any treatment, we need to get the consent from the patient. But there are some exceptional instances as well. If the patient can't communicate verbally, think about the situation. So one patient is coming to the emergency department after the road traffic accident. So the patient is having severe bleeding and the patient become unconscious. So whenever we are, whatever we are telling to the patient is not in a responsible manner. So with the why the patient become unconscious. So in this situation, and there are no one on besides of the patient. So the patient condition is very critical. So in this situation, the patient unable to talk, and on behalf of the patient, there are no one to provide the consent as well. If the situation is very critical, first we need to be concerned about the patient life. So as a healthcare professionals, our duty is to maintain, or we need to regain the patient survival. So in that manner, we can start the patient treatment immediately, although there is no any other concern profession. But after finishing the treatment, and if the patient regain their normal state, then we are preparing a legal document as a written consent from the patient, or it could be family members, and then we are getting the sign, and it is an acceptable one. So under the legislative framework, there is a one legislative framework. We can start as a healthcare professionals, we can start the treatment once the patient is in a very, very critical situation. If the patient is also unable to provide the consent, and there are no one to provide the consent on behalf of the patient. Only in this situation. In other situation, other than this emergency situation, if the patient is also normal, then the patient is conscious, or if the patient is mentally incapable, then we can have a third person to make a decision on behalf of the patient. So this is so why, so we need to have an effective verbal as well as the written, and sometimes we need to have a best non-verbal communication in order to enhance the autonomy in a health and social care working sector. The next part or the next key point is the information. So the information that we are going to provide to the patient regarding their condition, it should be an accurate one. You can't give any false information, as well as any assumptive information. Assumptive information means you can't tell to the patient, you may have this disease. The word may or might you can't use. If you are going to tell the patient is having the disease condition, particular disease condition, it should be accurate. You need to be confirmed. So sometimes patients, so think about the normal disease like fever or dengue is okay. But if it is a life-killing disease like cancer, HIV, so those things you can't assume and tell because the patient may admitted to complaining about any tumor. That means if the patient's body have some lump or tumor. So without going for any further investigations, you can't tell this lump, the lump or the tumor could be or may be a cancerous one. So think if you tell the words like those or if you tell the information in such manner, definitely the patient become anxious. So without having any proper investigations or without having any confirmative information, don't tell to the to the patients that regarding the conditions. So you instead of that you can tell that okay, so we'll see after or we'll confirm it what is the cause of that lump after or once the investigations finished. So once the investigation finished, if the lump is okay, it is a cancerous one, then you can tell to the patient confirmly why you are having the investigation report. So as an evidence, you can use that one. So the informations that are provided to the clients by the healthcare provider, it should be accurate one and the objectives should be there and it should be relevant and appropriate informations. The information should be specific to the individual situation. Any information may not affect the client's decision. Yes. So when whatever the informations you are providing to the patient, it shouldn't affect the client's decision. That means you can't tell each and everything at one time. So one, you need to have a collective informations that you are going to provide and you provide all the necessary informations at once, and those things won't affect the patient's decisions in the care planning. And also not all the individual having the same disease condition, then the treatment option also not same because the treatment option is depends on so many factors like patient's body and how the patient perceives those treatment options. It sometimes the cultural and the family members in all the factors are affecting the client or the specific treatment. So the informations that they are providing to, so likewise, so think about the situation. There are two patients are admitted. Both are admitted to the due to complaining about fever. So although they both of them are admitted to the fever, the way that we are going to treat both the patient are not similar because each and every person having a different kind of body mechanism, the body physiology. In addition to this, they are having other external factors like psychological factors, social factors, cultural factors are going to affect their condition as well as the treatment that we are going to give to the person. So each and every individual need a specific treatment. So if the treatment is specific, then the information regarding the treatments provided to the patient also should be specific. So you can't tell same informations to both the patients. Second one, the third one, the options, including alternative treatments or services, the risk and benefits of each, and that the client has the right to seek additional opinions about these and other possible options. So the option means, so what are the alternative treatment options available? So fever means, so what normally fever means we are taking Panadol in our home. So if we feel any fever. So although the patient admitted to the hospital, rather than giving Panadol, sometimes patient may allergic. Patient can't take the Panadol or patient become allergic to the Panadol. So in such situations, what are the other options we can have to reduce the fever? we can wash the patient body with the cold water to reduce the temperature. Or wait a minute. Or we can provide a good ventilation. So there are some other options available. So we need to instruct to the patients what are the other alternative treatment options are available. And also it is a patient rights. Patient can ask from the healthcare provider what are the other options or the opinions I am having instead of taking the Panadol, because I can't tolerate the Panadol. I may have developed an allergy. So in that situation, patients are having rights. So if the patient asking about the other opinions, healthcare provider can't refuse to tell the other opinions, and at the same time, he can't compel the patient only to take the Panadol. Okay, so information that will answer the specific questions of the care receiver. Yes. So whatever the information that we are providing, it should be answer for the specific questions of the care receiver. So it is also a care provider's important role in order to ask all the specific questions asked by the care receiver. Client has the right to refuse the treatment assistance. Yes. So each and every individual as a patient, they have the rights to refuse the treatment. If they are not like to have the Panadol, they can refuse the treatment. And the healthcare provider can't compel the person to take the Panadol. It is legally, it is legally not an ethical one. So the patient can directly claim for this activity of the healthcare provider. So the patient has the right to refuse the treatment. The healthcare provider needs to mention the name of the person. So this is another important one. That means normally in our Sri Lankan setup, they are normally in the Sri Lankan setup, they are normally telling for the doctors or the consultant, but not for the other healthcare professionals. That means if a person is going to have any surgery only, they are telling or they are informing to the patient that so the consultant or the surgeon names, so he is the one going to do the surgery. And most of the time the patients are not aware about the surgeon's name as well, because they are not going to tell to the patient. But when we are providing the information, it is important to tell the person's name. So who is going to do the care for that patient, what is the name, and what is his qualification. So what are the cares that he is going to do, whether he is a that means experienced one or not. All the information we need to provide to the patient. So why we need to provide these information to the patient, then only the patient may develop some kind of confidence. Okay, so if the person is a very experienced one, then the person is not, the anxiety or the fear regarding the treatment option we can reduce. And person or the patient also try to accept the treatment option. So it is important to provide all the information, but in the normal in the public Sri Lankan hospital setups, they are not providing. Even not only for the surgery purpose, they are telling, okay, this surgeon is going to do the surgery for you. But in the routine normal ward procedures, the most of the patients are not aware about the medical officers who are going to the normal physicians or the nursing officers who are caring for them. So but that culture should be changed. So each and every patient have the rights to know about the person who are going to do something today. So this is regarding the information. Third one is the comprehension. So comprehension means the care provider should supply the information in a way that make it accessible for those who need it to make their informed choices. So comprehension means the way. So although we are going to provide informations, the informations that the healthcare provider going to give to a particular individual should be accessible to that individual. So think about, so if you are so the person is having some vision problem, he can't read the small letters. Okay, so if you provide a information sheet with the small letters, then although you are providing information, it is not in an accessible manner. That means the particular individual can't get all the informations that you are providing. It is not accessible by him. So that is we are telling it as a comprehension. Comprehension means whatever you are giving to the, or not only the target is not only providing the information, but the providing information should be in an accessible manner for the particular individual. So here some example. If the person is having any vision problem, you can use the large prints or the language. So in Sri Lanka, so if we are going to, so as I already told you, normally in the researchers, we are giving the three language prints of the information sheet. And also in the hospital setup also, we are having some leaflets which are explaining briefly regarding each and every diseases. So those leaflets should be contains all the three languages. Then only or both the Sinhala people, Tamil people, or some people who can read and write English, they can make use of them well. And if the person is a blind person, then we can go for the braille style. So these are the way that we can make the accessible manner for a particular individual. Provider should shows consideration for the dignity of individual when discussing assistant treatment of procedure. If client feel deprived of their dignity, for instance in a state of unrest, they will feel at a disadvantage and may not be able to concentrate on the information. Yes, so dignity and providing privacy, respect are kind of same. So whenever you are dealing with the patient as a healthcare provider, it is our duty to maintain the dignity. So in previous lectures, we studied what is this dignity means, what are the importance of providing dignity, in which instances we are maintaining dignity. So dignity is the another major one we need to be follow as a healthcare providers. Each and everyone need to follow when they are providing the care. Why? If the person feel or if the patient feels at any instance that the person's dignity is not maintaining in a well manner, then they won't accept the care provided by the healthcare provider at full. So they starts to refuse the treatment, or they won't concentrate on the informations providing prior to the treatment, and that also will cause some consequences after the treatment options. So here I provided one example. So some instances we are undressing the patient. So if we are going to, that means for the examination of the body, the doctors they will ask the patient to undress. So if you are going to ask the patient to undress, then you need to provide a proper privacy on in that manner. So you can't ask the patient to undress in front of all the patients and all the other healthcare professionals. So if you are going to examine the patient body, you can take the patient to a private room, or you can cover the patient with a screen. In that manner, you can provide the privacy. And also when you are undressing, you can undress and you can cover all the other areas with a bed sheet, and you can expose the particular area that the healthcare professional going to examine only. So when we are doing this, then the patient will feel okay. So the patient also have some privacy concern. So they will feel that okay, I'm having a privacy. Then they will cooperate with us for the care need. And also, the provider should make sure that the care receiver have adequate privacy during the discussion. Lack of privacy can make feelings of disadvantages and reduce the client's ability to concentrate on and understand the information which I just told you. Provider should allow time for the client to think about the information provided unless in emergency situation. Yes, this I already told you. So once you provide all the information, you need to give some space or give some time for the care receiver in order to take a decision. So in that, you can allow the patient to have a detailed discussion with the family members on close relatives, and also you can ask the patients to have some times to think about the treatment options. You can't rush the patient to make the decisions once soon after you provided the information. So you need to give some space as much as possible. But if it is an emergency situation, as I already told you, we can provide these instances. So in only in the emergency situation, we can act according to our wish as a healthcare provider's wish, but that act also should be beneficial to the patient life. It does so if it can't do any harm to the patient life, once we are not taking consent or we are not allowing the patient to take their own decision. So this is regarding the comprehension. And the competence. So the competence, I already told you what is this competence. That means a patient's capacity, how he or she is going to perceive the condition, perceive the treatment, how they are going to decide their treatment option. All these things we are telling it as a competence. Except where there is a clear evidence to the contrary, the care provider presumes the client is competent to make decisions about the assistant. Yes, if there is any contrast or if there is any opposing activities, unless that clear opposing or the clear evidence, the normally the care provider, they are assuming or they are taking that okay, the particular patient is competent enough to make their own care planning. Treating a person as an incomplete or as not having capacity removes their autonomy. Consequently, providers make every effort to support and enhance the decision-making capacities of client. Yes, so unless the person is not having competent enough with the watch. So if the care provider can't address or can't tell that the person is not competent enough or the person not having capacity to make their own decisions. Likewise, the care providers cannot address any individual. Why? If they address like this, then it can make an effect on the patient's autonomy. Autonomy means it can make the patient's it can affect the patient's self-determination. So if that occurs, then it will become a problematic when we are talking about or when we are engaging the person in a healthcare decisions. If the client wishes consultation with an inclusion of the family or friends, it could be also helpful for the part of this process. A court document confirming that the client is not competent or if the client is having any lack of mental capacity, it can be required at each and every situation in which that the healthcare provider is going to take the informed choice or informed consent. So yes, so if there is any person or the third person going to take the decisions on behalf of the patient, then that patient or that particular individual should have a court confirmative document. It's a kind of legal document which should state that this particular person is not competent enough or he is not mentally capable. Then only we can allow the third person to have or to make decisions on behalf of the individual. So this is regarding the competence. An absence of coercion. So I already told you coercion means compulsion, constraining. So if we are another person or we are as a healthcare providers also we are compelling or we are forcing a person to accept this procedure or we are forcing the person to undergo for the surgery. So, but in the autonomy or in the healthcare sectors, we can't compel or we can't force any patients to accept the treatment options that are selected by a healthcare professionals. That is, we are called as the absence of coercion. Right to refuse proposed treatment, yes. Each and every patient having a right to refuse the treatment which are proposed by the healthcare professionals. Sometimes the healthcare professionals may take the decisions without involving the patient. So the patient may not like the decisions taken by the provider. In such instances, there are no any forcement, or there are no any compulsion to accept that decisions. The patients have the right to refuse once they are not like to undergo for the particular treatment options. And if so, if they are going to refuse, they need to provide a so although they so that means no need to provide the reason. There is no any uh, the patient, no, there is no any compulsion to provide or compulsory to provide the reason. But if the person or the patient is providing the reason also a good manner, so they can refuse. So although the refusal of the treatment going to provide some harmful or the bad consequence to the patient, still we need to, as a healthcare providers, we need to accept the those refusals. So although we are accepting, we can try to convince the patient that why, what are the consequences he or she will face once he refuses the treatment. But we need to accept it, although we know that okay, the patient is going to have a bad consequences. So this is another part where the patients have the right to refuse the treatment. And advocacy means it's a kind of advocating. So care provider inform the client of their rights to have other people of their choosing present during discussion, and their wishes on this shall be respected. So it's the same. So normally the care provider, so we need to inform to the client. That means sometimes the clients, they are not aware whether they can include the family members into the treat care decision. So as a healthcare providers, when you are starting the conversation with the patient, at the beginning you can inform to the patient that if you need, you can include the family members or the close relatives with you in the care discussion or the care planning. So and also it is a right for the patients to include them. So in that you can include your friends, relatives, family members, spouse, or anyone who is very or who is making all the efforts beneficial for the particular patient. Providers shall seek and take into consideration children's wishes. Yes, and also normally when we are going for the pediatric patients, pediatric means for the small patients. So normally we are getting the consent and we are asking all the treatment options from the parents, the mother or the father. But we can, if the child is can understand well enough, like about 6 7 8 9 10 year 8 9 10 standards, that means if the child is 12 13 14, they can understand some informations once we provide it in an understandable manner to them. So in those instances we need to accept what are the children's preferences always. So rather than asking from the parents, we need to ask from the children, and we need to accept or we need to consider those things when we are planning the care. In situations where communication between provider and client limited or impossible, an appropriate interpreter, facilitator, or resource person shall be used. Yes, sometimes the patient can't talk. So in that situation, we can have a facilitator. So that means if the patient can't talk, but the sign languages, so in that we can interpret it, or in kind of for the language, the different language people, so we can act as a translator. Or sometimes we can, so in those sign languages, we can act as an interpreter. So it is, we are telling it as an advocacy. So these are the major key points that which we need to follow when enhancing the autonomy in the patient care. So are you all clear up to now? Or do you have any questions? Do we have any questions? Hello?
No, ma'am.
Okay, thank you. Now we'll see the second principle, which is responsibility. So responsibility means normally, so it is refers to who. So responsible, it is simple. So normally the common term that we are using in our day-to-day life, responsible person, responsibility. So when we are asking or when we are taking any activity, so we are asking who is that person. So who is that person means who is a responsible one for that particular action. So it is, we are calling it as a responsibility. So in a informed choice or the informed consent, so when we are talking about the responsibility, it involves two main points. One is individual responsibility and other one is a shared responsibility. So individual responsibility means normally a person, it is individualized. So each and every individual in a particular action should have the responsibility for the particular action. Because of the inequality prevails among the provider and the client, the provider had primary responsibility for providing information that will help a client to make an informed choice. Yes, the healthcare providers who are providing information prior to any treatment option is we are calling as a individual responsibility of a healthcare provider, because normally the patients are not aware about their condition. So when we are the healthcare providers, they are responsible one to providing the information. So it is individual responsibility. But the shared responsibility means, so here both the healthcare provider and the patients are responsible for the particular action. That means, so normally the action planning or the care planning are undertaken collaboratively with the healthcare provider and the patient. So whenever the healthcare provider is going to give any instructions to the patients, so the patients also try to provide the instructions what they are going to have. That means we already we saw that a rational conversation. That means both the people who are involved, healthcare provider as well as the patients, they need to provide why they choose this treatment, or the why the if it is a healthcare patient, why they refuse the treatment. So they are having a rational conversation. So that rationalized conversation is a kind of shared responsibility. So clients have the responsibility to inform about their health status and circumstances. This will help to develop and sustain a collaborative relationship between healthcare provider and receiver, which in turn will produce information that is most relevant for both parties. Yes. So share under the shared responsibility, even the receivers, the patient also having the responsibility to tell about, because normally the although the healthcare providers are checking and doing all the needed care for the patient, but without some patients, they need to tell what they feels now, how they feels now, what are the conditions or what are the new signs and symptoms they developed. If they are not saying those things, then the healthcare provider doesn't know what they developed newly. So in order to have a good outcome, the clients also having a responsibility to mention about their health status each and every time to the healthcare provider. So this is the second principle. The third one is accountability. Accountability is also a similar to a responsibility, but the difference is accountability means if I am doing anything, I am the only person responsible for that activity. So refers to how a person responsible for the informed choice process is answerable. So if I'm going to do anything, If any either bad or good happens, I am the responsible one for that because I did the action without any person's assistance or without any person's order. So I did all those things. So I am the only one going to take the responsible for that. It is we are calling as an accountability. So another term, quality or state of being accountable, acceptance of responsibility for one's own action. So the major thing is we are going to accept our responsibility. Responsibility means we are just seeing what are our responsible, so who is responsible for that. But accountability, we needs to accept our responsibility. Yes, I am the responsible one for this. So you can't neglect your responsibility. So this is we are calling it as accountability. So under the accountability, we are having the key points. So normally the accountability we are telling for the informed consent or any other consent. So because if I am the one going to get the consent from my patient, I am the accountable person. That means I need to accept that I took the consent from the patient. So consent means simply, normally we are telling all the information to the patient and we are making the patient to accept the particular treatment option. So if the informations that are provided by me is wrong, then the patient also understand it in a wrong manner and the consequences of the treatment option will be harm to the patient. So if it occurs, then the accountable person is myself because I am the one who provided the incorrect and the inaccurate information. So I need to take the responsibility and I need to accept the responsibility for the harmness occurs. So that is we are calling as accountability, and mainly the accountability involves the consent, implied consent, general consent, spoken or it could be a verbal consent, written consent and the documentation of the informed consent process. So first we'll see what is this implied consent means. Normally the implied consent we are not assuming it as a informed choice or the consent. So in the under the implied consent, so but the examination treatment, it should be undertaken only with the reference to the principle and the guidelines. That means we are not telling all the things to the patient. We are not getting the informed consent from the patient. We are doing whatever the examination or procedures according to the guideline. So each and every procedure, we are having some steps, no? So whether the steps, all the steps are good or bad to the patient, we are not getting any information. Just we are applying onto the patient according to the principles and guidelines, which is in a documented one. That is implied consent. Implied means we are implying, we are imposing something. General consent means it is the normal consent we are requiring before the patient any examination or anything. We are just informing the patient regarding the what we are going to do to the patient, and we are obtaining the consent from the patient. So under the general confirmations, we are not providing any detailed information to the patient, just a major. So what is the patient condition, what we are going to do, that's all. There are no any detailed information regarding the procedure or whatever the equipments we are going to use or what are the benefits or good. We are not telling to the patient. So it is a general consent. Spoken consent or the verbal consent, it is means it is coming under the informed consent. That means verbally a healthcare provider going to tell all the informations necessary for the patient and getting the consent whether he is accepting to participate or engage in a treatment options or not. And at the same time, during the verbal consent, we are providing a chance for the client to ask the questions regarding whatever the queries he is having regarding the treatment option. And also the healthcare provider have the responsibility to answer, to provide accurate information for the questions proposed by the client as well. Then written consent, yes, it is also a kind of informed consent which we are normally routine health sector practice. We are not, that means we are explaining all the things to the patient verbally, then we are getting a signed. We are getting a signature from the patient or from the family members on behalf of the patient, whether they are accepting this or not. Prior to the surgery, we are normally in the movies, you could see that prior to the surgery, they are getting the sign from the family members or any patient in a one legal document. So why we are getting that signature? That means the patient is accepting whatever the consequences happens after the surgery. He will accepting that one. He is going to accept that one. Why? Because prior to the treatment options, we are telling all the benefits, harm, all to the patient. So once he received all the information only, he is accepting that surgery. So he is also responsible one after the consequences of the surgery, and he can't claim or he can't blame anyone or any healthcare professionals soon after the surgery if he encounter any problems. So for that purpose, it is a kind of safety purpose for the healthcare professionals. So we are having a written consent form. And also the consent form in our public sectors, we are asking the patient. So normally we are maintaining one record. So we are asking the patient to write it down in their own language. It could be whether English, Tamil or Sinhala, whatever. We are asking the patient to write it in their own language with their own handwriting, that they are accepting this treatment option. Normally in our Sri Lankan public hospital sector we are following, or in sometimes we can for prepare a printed document and we can provide it in a accessible manner. That means in which language the patient is preferred to read, and we are giving to that to the patient, and we are asking the patient to read, and we are getting sign. If the patient cannot read, that means sometimes if the patient is uneducated one, then we need to we need to give all the necessary informations provided in the sheet verbally to the patient. We are going to get the uh, sign. That means it's not a sign. We are going to get the fingerprint of the patient. So this is regarding the written consent. And documentation of the informed choice and the consent process means, so normally, so documentation is important when we are talking about the informed consent and the choice process. Then only if there is anything happen, we can have it as a legal one. So the documentation records not only a client's informed choice, but also it confirms the client's comprehensions to the options and their selection. And it should consist of brief notes which are outlining what are the informations were given to the client and when this was done, and whether the client understood or not. All the things we are outlining in a brief out manner, not in a detailed manner. And also, if another person is going to decide on behalf of the client, a legal document that support a delegation of authority must be existed in the client's permanent file. So this delegation of authority, in other terms, we can call it as uh, we will see, we are calling it as LPA, that is power of attorney. That means power of attorney means if the person is not capable, then another person is appointed on behalf of the particular individual to make all the decisions. It could be a financial or it could be a patient's welfare, health activities, whatever. We are appointing one person. That is, we are calling it as power of authority or the power of attorney. So that power of attorney is a legal document. It is given by a court. So during healthcare treatment options, a particular individual who is going to propose on behalf of the person or the patient, he or she should show, or he or she should attach or provide that power of attorney to the healthcare providers, and they should attach with the record of the patient. Documented confirmation of client status of not competent shall be required in each and every situation. Yes. So normally in other activities also, when we are documenting, we need to have this non-competent document, the legal document which was authorized by the court. It should be attached in each and every patient's treatment options. So this is regarding the documentation of the informed choice and the consent. So these are the major three principles which is going to govern, or guidelines which is going to rule out the informed choices or informed consent when we are talking about the health and social care sector. Then we see the court of protection. So mainly this court of protection coming under the Mental Capacity Act. So it is a law, English law. Normally it is proposed in a United Kingdom. So it is an English law which is proposed by the Superior Court of Record, created under the Mental Capacity Act 2005, which is used to govern the property, financial affairs and the personal welfare of the people who are having lack of mental capacity or who are not competent to make their own decisions for themselves. So this is, we are calling it as a court of protection. So the court can make decisions about whether the actions that are taken on behalf of the person is appropriate, or whether the actions taken on behalf of the patient is beneficial or not. And also it is helps for the situations where a series of decisions rather than a single decision will need to be made for you or not. So if I am a mentally incapable person, then the situations where a series of decisions, so rather than taking a single decisions, whether it is good to take a series of decisions on behalf of me. Why? Because I am not a capable one. And removing an attorney under your lasting power of attorney, or removing a deputy. That means if the activities that are taken on behalf of me by a third person is not beneficial for me, or if it is going to make a harm to me, then the under the Court of Protection Act, the court has the power to remove the attorney of law, or the attorney of lasting power of attorney which I was given to a particular person. Okay. And also the health or the personal care where there is no attorney to make it, and the court must always act in best interest when it makes this decision for you. Yes. So when the court is going to make all the decisions for the incapable person under the court of protection law, the court also needs to take a rational and a good decisions for a particular incapable person under this action. So this is, we are calling it as court of protection. Next one is, I already told you, LPA, lasting power of attorney or the power of attorney. That means normally it is a legal activity, power of attorney. We are having a legal document. So through this document or through this power, we are giving a power to a third person on behalf of myself to take decisions regarding my financial affairs or healthcare affairs. Okay, normally in the healthcare sector, we are using this lasting power of attorney or power of attorney once the patient is incapable of making their own decisions or incompetent. But in normally other setups also, we you have encountered this word power of attorney. So that means, so some land. So if I am owning one land and I am not so think about, I am in abroad, I am having my own land in Sri Lanka. So if I am having difficult to come and look after my land, then I can give the attorney or the power of attorney to my friend or any other family member who are here to look after. That means they can take any decisions regarding my land on behalf of me if I am not available at that time. So it is a different kind of power of attorney. So here I am not competent enough, or I am not mentally incapable, or I am having a different problem. I can't visit frequently. So I am having difficult to look after the land. So in that manner, I am giving the attorney power on behalf of me to take and decisions to my friend or family. So it is also a power of attorney which we are using in our normal other setup. But when we are talking about the health and social care setup, especially this is power of attorney and court of protection are applicable to the people who are mentally incapable, and all these things comes under the Mental Capacity Act 2005. And the other one which we need to know, duty of care. So duty of care means the duties that are undertaken by each and every healthcare provider as a healthcare. That means the healthcare provider in the care profession, it shouldn't provide, it shouldn't make any harm or any bullying, any abusive to the particular patient. That is, we are calling it as a duty of care. Where reasonably possible, your action must not place an individual at risk of danger, harm, or abuse when caring for them. By taking a job in care or taking on a duty to care, therefore you owe it to your service users to care for them. So duty of care is kind of, so I am owing my duty to provide a care to a particular patient. So this duty of care not only to the healthcare professional, each and every sector. So now I am lecturing. So my duty of care is to provide. So it is a kind of, my duty of care is to provide a good lecture note and to make a good understanding regarding the notes and to prepare you for the assignment. So it is my duty of care. So my duty is to owing you to have a good knowledge in a particular module. This is duty of care. So if we take any bank assistant, so they are having their duty of care regarding how they are receiving the customers, how they are working for the customers, how they are maintaining the records, and how, both in the technical manner or the computing manner, how they are working, whether they are having all the records in a proper manner. It is a kind of duty of care. So simply duty of care means what are the activities or services we are providing for the customers or the patients or the clients. We should provide it in a reasonable manner. So the care that we are providing or the services that we are providing to those people, it shouldn't harm them or it shouldn't cause any danger, injury or abuse them. It is, we are calling it as a duty of care. So when we are talking about the duty of care, there are some legislative frameworks are there in which we need to follow, or we need to responsibly follow when we are going to use this duty of care. And especially these legislative frameworks for the duty of care is confined to the health and social care sector, like the Disability Discrimination Act 1995, Children's Act 1989, Disabled Person Act, Sex Discrimination, Race Relations, Special Education Needs and Disability Act, Health and Safety at Work, Safeguarding Children, and Special Educational Needs. So this means, so when you are carrying out your duty of care, if you have any unfavorable duty of care, that means if you are not following your duty properly when providing care, if the care receiver find out any improper in your duty, or if the co-healthcare professionals, your co-workers providing your care in a proper manner, or if you are not doing your duty in a proper manner, then they can they can claim you in a legislative manner, in a legal manner. They can accuse you. So why? Because each and these all the legislative frameworks are mainly proposing how a healthcare provider needs to have their care or needs to maintain their duty in a proper manner. So these are the laws that are underpinning in order to upload or in order to follow the duty of care in the health and social care sector. Then we'll see the code of conduct. So we already studied what is code of conduct and what are these code of ethics means. But this code of conduct is we are calling it as a professional code of conduct. So as a professionals, what are the code of conducts we need to have? So professional code of conduct means it is also a kind of legal document which explaining how an employee should be expected to act on behalf of their institution. That means normally code of conduct we told that it is a legal document which is telling that how a person act or how the person support or providing a care to or how they are providing a services to the needed person. So professional code of conduct mean it is also explaining how each and every employee or each and every professionals how they are representing the each and every institution by their activities or by their behaviors. They are going to represent the institution. So if the professionals activities are good, then we can tell, okay, this institution is good. So normally in Sri Lanka, we are not having so many private sectors, but although we are having some private sectors with the activities of each and every healthcare professionals, we are addressing. Okay, we can go to this private hospital because it is good. They are providing this kind of care. The healthcare professionals are good, or this consultant coming or visiting surgeon is coming. So that means so each and every healthcare professionals according to their activities and behavior, they are representing the particular institution or the organization. That is we are calling it as professional code of conduct. So the elements that including in the professional code of conduct are the values and the disciplines that they are following and the responsibilities of each and every professionals, how they are following them. And here the professional code of conduct, it includes each professionals, they should be very patient and they should be very courteous or polite when they are working. They should be very, very inclusive. So they should identify the difference of the patients, and but although they are having difference, they don't use the discrimination act. They should be very inclusive. They should be considerate about the each and every individual they are looking after. What are their preferences? What are their needs? What they are desiring? What about the options, suggestions? So they should be considerate, and they should be respect the decisions or the rights taken by the individual and the activities, even the religion, caste of the patient. They should respect all the things. And the language and the words they should use carefully. Even the body language, gestures, the attitudes, the behaviors, how they are standing, how they are addressing, how they are welcoming the patients, how they are using the tone, what are the words they are using, whether they are using it in a polite manner or whether the sound is very low, calm manner. And do not harass. Yes. So they shouldn't harass or bully the others physically, psychologically, culturally, spiritually in all the manners. And they should be unique. So the each and every healthcare professionals, they should identify their strength and they should identify their difference. How can they provide the care in a different manner from other healthcare providers? What are their abilities? What are their strengths? So they should be very, very unique. So these are the components or the major principles that each and every professional should follow when they are providing a care. That is, we are calling it as a professional code of conduct. The another part is professional ethics. So professional ethics means it is concerns one's conduct of behavior and the practice, how they are carrying out their professional work. So when they are carrying out their professional work, how they are behaving or how they are practicing it. That is, we are calling it as a professional ethics. So professional ethics must taken into accounts. So how? So when we are talking about the professional ethics, so we need to consider about the relationship, how the relationship between the professional and the clients, how they are behaving, or the how the relation between the profession and the co-professional as well, how the relationship between profession and society, relation between employee and the employer. When we are talking about other than the healthcare sector, how the relationship between the employee and the employer, and with the technical employers and the technical data, how they are handling. So it is, we are calling it as a professional ethics. So under the professional ethics, the professional code of ethics include, they should symbolize the professionalism. They should. So with the activities and their behavior, we could tell, okay, he is one of the professional. So they should symbolize each and every professions. They should, with the activities, we need to address, okay, he is a consultant, he is a physician, or he is a CEO of the company. So they should symbolize their professionalism. They should perfect the group interest and specify the membership, and they should inspire the good conduct, and the employers or members of the particular institution, they should educate them, and they should instruct them how to be a disciplined manner, or the discipline principle, they should educate them, and they should foster or impose the external relations when they are developing their professionalism, and they should calculate or they should count the principles, and they should express the ideals. They all need to organize the rights and responsibilities, and they should put forward the rules and offer the guidelines and all the things. So these will consider under the professional code of ethics. So professional code of conduct and professional code of ethics are different. So you already know what are the code of conduct and code of ethic means. So these should be included if he or she needs to be a professional one. So we are telling it as a professional code of conduct and the professional code of ethics. So that's all about the today's session. Here I have uploaded so many videos, some videos you can go through and see if you need extra references. So they have explained simply and in a detailed manner. So what are these informed choice? What are the informed consent and autonomy, accountability in an animated manner? So you can go through this, and other than this, there are so many other links and research articles are available. So you can go through that as well. You can ask any questions if you have, or you can provide your ideas and suggestions regarding today's lecture now. If you have any doubts, you can ask. Or if you are clear, we can wind up the session.
We are clear, ma'am.
Okay. So now we can wind up our session. I already uploaded the presentation, that PDF, to the class note as well. You can go through it, and those who didn't attend the class, you can go through the video as the recording as well. Until I meet you all in the next week, bye bye. Have a nice day.
Thank you, ma'am.
Thank you, ma'am.